So this is the outline of today's talk. First, I'm going to go over what AML is and our way to personalize medicine by genetic testing in acute myeloid leukemia. Then I'll go through the FDA-approved small molecule targeted therapies for newly diagnosed AML and also relapse refractory AML. And these are the drugs that I will be talking about. And lastly, we'll touch on the future directions with new exciting therapy options. So can one master key open all locks to AML? And that is what used to be our treatment strategy, where we take one chemotherapy and give it to everyone. However, we all know that that's not efficacious for everyone. All locks are unique, and so is everyone's AML. So we must individualize our keys and our therapy options to unlock all the AML, different types of AML. And this is what we call personalized medicine, individualized treatment options to everyone's unique leukemia. So today, I'm very excited to discuss the targeted therapy in AML, and especially the small molecules, which is the first step to personalized medicine. So to understand that, we'll have to go to the basics and talk about what is acute myeloid leukemia and how does it happen. So in our bone marrow, which is inside our big bones, like our hip bone or our leg bone, is an organ called the bone marrow. And the bone marrow is a factory for all of our blood cells. The red blood cells that make our blood red, carries our own oxygen, the platelets, which help stop bleeding when there's a cut, and the white blood cells, which are our immune system. And these blood cells all come from a stem cell. A stem cell is a baby cell, and these baby cells grow into different types of adult cells. A particular type of stem cell we are interested in AML is this myeloblasts. These myeloid stem cells, and when they commit into a lineage, grow into a myeloblast, which arise to white blood cells. But when there is an insult to that myeloblast, and that is when acute myeloid leukemia develops. So in a normal cell, when there is an insult or a DNA mutation, when there is an unfixable DNA damage that happens, then normally these cells will activate mechanisms to die. But in a cancer cells, there is a DNA insult or mutation that has prevented the cells from dying. And unfortunately, instead of dying, they start growing and dividing. And when that happens to a white blood cell, that's what we call a leukemia. If that happened to a lung cell, that would be a lung cancer. If that happened to a breast cell, that would be breast cancer. And that happened to the myeloblasts that we looked at just before and developed into acute myeloid leukemia.